Oh, that's good. I know I love you.
Okay, the first thing that I am charged with speaking to you all about is a reminder to fill out your evaluations. So that is very important, and you can give those to Lynn or Dana after the day is over. I am April Harris. I work for a health department in Kentucky, Three Rivers District Health Department. I serve about 4 very rural counties. We have less than 50,000 people, and we started the accreditation process very early on by doing a strategic plan and community health assessment work, and we were in the first cohort, like Lynn had described, with Keith and Dana. So we're partners in this process. And I will say that I am a trained FAB site visitor, but while I'm speaking to you all about site visit stuff, this is just coming from April Harris at Three Rivers, not anything with FAB. So I'm going to talk about something, a little mini event that I had leading up to submitting all of our documentation to FAB. And Lowry did an excellent job this morning talking about the process leading up to submitting the documentation to FAB. So very selfishly, when I was at the FAB in-person training with Keith and Dana, December 2011, I was sitting in my seat next to my director, Georgia Heiss, and it all became real to me because EFAB was going live in January. And up until that point, it had been this pie in the sky thing. Oh yeah, we were doing accreditation, we were going to go for it. And then when it all became real, I freaked out. And so I had this aha moment as I was sitting there in the training, and I thought, we have to have some type of mechanism in place for some other people to look at all of our stuff before we submit it. Because I was confident in everything that we had done, but I needed extra confidence. So that is where all of this kind of came from, one freak out moment in the FAB applicant training. So I want to talk about guidance for organizing and conducting a mock site visit or documentation review to assess your documentation readiness prior to submitting to FAB. And also share the lessons that I've learned that when I did the process, and then I've been a part of about 7 or 8 other documentation reviews since that point. So it's definitely grown and matured into a very useful tool. So the first part of it is preparing, which, like I said, in December is when the applicant training was. We did somewhat of a 3-phase approach to our documentation review. So I'll talk about that, but it couldn't have happened if I wasn't prepared with all of the documentation, and Lowry had talked about organizing your documentation, preferably in electronic. We had it all hard copy, so it was a little bit different. So the preparing for it and bringing the right people to the table is very important, as well as having all of your documents in some form or fashion that people can look at and review. But having a consistent review method was also very important. We used forms for every piece of documentation, and I'll show you those, as well as other forms that have been created since that point. And having an overview of scoring so that everything was consistent. And then bringing in a broad representation of people to look at your documents, because you want as wide of a perspective as possible. So when you're going through and you're collecting all of these documents within your health department and within your community, sometimes it can be a very closed approach. You know what the acronyms mean, you know what the documents are, and it's not until you have a fresh set of eyes come in that you realize, oh, the meeting minutes aren't attached, or this doesn't really make sense to me. How are you going to tell this story in a way that would make sense to a site visitor? So looking back, we only had staff within the health department and staff from other health departments. The next time I do this, I would encourage you that you have a board member or 2 or community partners involved. Definitely other health departments that are going through the accreditation process or thinking about going through the accreditation process, because it is a great learning tool. We did use subject matter experts and other health departments as well. We've always tried to be very transparent with our accreditation process and encourage others to do it because it is very manageable. It is the work that you're doing day in and day out. It's just packaged and labeled a little bit differently. The benefits that we had from doing a documentation review prior to submitting to FAB were the identification of gaps, and you'll see this throughout my presentation, but the biggest gap that we had, because we didn't really know about it until the FAB in-person training, was that you had to have a document description with every piece of document that was uploaded. So that was something that was very inconsistent with all of our documentation leading up to the document review. And so after that, we tried to, as an agency, create a template that everybody could use when they were creating their document description, so they weren't all over the place or a lot of information that wasn't useful. Something else that was a big gap, and this is just related to logistics of the documentation, but some of our staff had not highlighted exactly what needed to be looked at or identified page numbers. We have how many plans and policies do we have that are 20 and 30 or 100 pages long? And your site visitors, you want to keep them as happy as possible and direct them to exactly what they need to look at. So that was another huge gap that we had. The involvement of others probably superseded everything else because we had staff that had not been intimately involved with our accreditation process involved in our documentation review. We had Department of Public Health, our state agency, involved in our documentation review. We had other health departments that were not even beginning the accreditation process, and it served as a great tool for them. So the involvement of others was extremely important walking away from that. Regardless of all the feedback I got on the documentation, just bringing other people in was an awesome experience. And then like leading into that, the training. So more of our staff got acclimated with reading the standards and measures and judging documentation related to those standards and measures. And then there were 2 or 3 accreditation coordinators from other health departments that had not gone to the in-person FAB training, and afterwards they walked away and said, we can do this. You know, now that we can actually see your documentation and know how, in some form or fashion, how it is judged, we can do it. So it was a great training tool for other accreditation coordinators. You know, there's not really, besides the applicant training, there's not all these accreditation trainings, and there especially wasn't in 2011 and early 2012. So that was, it is a great way to train other staff about accreditation and the work that you've been doing. It also built a lot of buy-in across your agency, especially when you can demonstrate to your staff, hey, we're going to bring in other people to look at our stuff because we want it to be that much stronger when we submit our documentation. So it was a way for other health departments as well to become more invested in the accreditation process. When you've got 400 pieces of documentation staring at you in a conference room, it becomes very real. And the comfort level that people had with the whole process after this day and a half was over was extremely positive. And I had my staff come up to me and say, I have such greater appreciation for the work that our FAB team has been doing to get all of these documents together that I didn't have before. And so when you are really involved with the accreditation process, you forget what it would be like to be one of those people that has not really been asked for documentation or been a part of a team meeting when you're trying to figure out what we should submit. So it was a great way for our staff to also be more comfortable with the process that we were investing a lot of time and energy into. So I said in December 2011 we had our training. In early 2012 we did phase 1, which was our FAB team and our management team. At the end of January 2012 we did phase 2, which was the in-person documentation review with external and internal people. And then in early 2012 we did phase 3, which was the accreditation coordinator, myself, and my director. And so that's kind of the way that we did it so that we covered all of our bases. And it was a really quick turnaround, so that's why I stress the preparation point, because my biggest lesson learned is if I knew how valuable this was going to be in our process, I would have prepared more for it and had more evidence of how well it worked for you all. So phase one, we had a FAB team, and when, like Lowry described, that was the very first thing that I did as the accreditation coordinator. And I chose all frontline staff. And I get very emotional about this because I wanted more people to be invested in public health. And our management team is awesome, and I wanted them to be involved, and I wanted their support, but I really wanted frontline people to have this experience because I have been granted so many experiences that I probably didn't deserve at the time, and I wanted more people to have that. And I felt like accreditation, there could be no greater experience in public health than being involved with accreditation. So my team was, they averaged about 3 to 4 years of experience at our health department, and none of them had formal public health training or education. So it was a great learning experience for them and for me to lead them through it. And then we also brought in our internal management team because they were not involved with the actual FAB team. And so it was really cool to see some of these frontline staff leaving the accreditation team meetings and having to go to their manager or supervisor and asking them for documentation. So there was a lot of leadership skill building and team building built into our FAB team. So our first phase was bringing the FAB team and our management team together in our conference room to just duke it out. And what we would do is we went through every single measure, and whoever from the FAB team, there was a representative from each department at our health department on the FAB team, they would read the standard and measure, hold up their document, and explain why it was the best example, and read their narrative or document description. So they would explain why it conformed with the measure, and then the group would offer feedback. And I learned then that we had some communication gaps, because the manager would then say, oh, well, we did this investigation report in 2010, that would have been a great example for this. So the next time that I go through this, I will have a little bit more communication between each department and their representative as they're selecting documentation, just to ensure that the best example is being presented. But for the most part, it worked really well. So the group would offer feedback, and they would kind of say, you know, this is ready to go, or hey, you know, there's a better example out there. But keep in mind, this was in beginning of January, and I knew that I was bringing these people together at the end of January. And so that was kind of the extra push, like, there's no more waiting game. There's no more time allowed. Like, you got to get this stuff in, because people are coming at the end of the month to look at this. So that was a really good thing that we had that timeline. And I know that Lowry talked about the timelines, and even though you have to build in a little bit of extra room for things to go wrong or things to come up at your health department and with FAB, you know, they're working on their own timelines as well. And we also worked through a key messaging document that Alan Kalos out of the Northern Kentucky Health Department created. So as we were going through all of these measures and figuring out what was working, what wasn't, we were also developing key messages for every domain. And you can't see it really well, but there's a space for 3 positive messages and 3 opportunities for improvement for each domain. And so as we're working through all those documents, then we would come up with, in domain 1, a really key positive message with domain 1 is that we built MAP partnerships in every single one of our counties. And so then all of our management team and all of our FAB team, which is pretty much all of the staff that were included in the domain interviews during the site visit, were, you know, feeling very comfortable with the messages that we wanted to portray throughout our documentation and throughout our site visit. So we did that with each one. And we also kind of wanted to be able to have a consistent message, so that when a site visitor said, well, what are your overall opportunities for improvement here at Three Rivers? Instead of all employees having something different to say and then looking like, you know, we've got a whole lot of opportunities of improvement, we had 3 or 4 already canned, and so that was, you know, just we're in a very rural area, so we don't have a lot of funding. And so then everybody was saying, you know, funding's a big issue for us instead of many, many, many opportunities for improvement. And so that was the positive messages overall and for the opportunities for improvement. And I'm sure this is probably on one of the NACCHO sites because Alan's been really good about sharing this key messaging document. And he also has another document to explain how to use this. So get on the NACCHO accreditation website and you'll have some of these tools that I'm going through. So any questions about the key messaging document? It was very, very helpful for us to identify the really good things that we were doing and then get on the same page together about things that we could do better. So the lessons learned from phase 1 was to break up the time. I had thought we could do it all in one day, but everybody was getting called away for little emergencies, and so it would have been better to break up the time. And then we could have done a little bit better job about utilizing our time together to prepare for the site visit and for questions from the site visitors instead of just focusing on that, because people can get really burned out looking at all those documents over and over. And just really encourage the group discussion, because that's when you start seeing different perspectives. So when the nurse is looking at some of the health education stuff and they're saying, oh, but the clinic is also doing this coordinated health education messaging by X, Y, and Z. And then we realize, oh, well, we can also include that documentation in it. But we would have never had that if there wasn't a lot of group discussion. So that is very critical. Okay, so phase 2 was probably what I was prepared for the least, even though it was way more successful than I could have ever dreamed it to be. It was a 2-day review on site, so there were people from all over the state that came. The only expense was breakfast and lunch for 2 days, and then whoever needed a hotel room for 1 or 2 nights. It was very minimum. It involved 6 Three Rivers staff that were not involved in the accreditation process, and external public health people, 3 accreditation coordinators from other health departments, a preparedness manager that was also from a health department that had achieved Project Public Health Ready status through NACCHO, so I knew and felt very confident in her ability to review preparedness documentation. There was a policy analyst from our state health department that was meticulous in reviewing policies and plans, and then our state public health improvement manager, as well as she also used to be an epidemiologist, so I tried to use her for both roles. So there was about 12 people, and the main goal was for every piece of the documentation to be reviewed twice. So that was going to take place over 2 days, and I had assigned them to domains that I felt like they would be the most acclimated with, or they had subject matter expert. I had invited many more people. I had invited other health department directors. I had invited some people from the University of Kentucky, but it was really short notice. You know, this was planned in early January. It happened in late January. So it would have been, I would have included as many people as I possibly could have. It was just a logistics thing. So day 1, we had introductions so that everybody could get to know each other, and then I gave them very specific instructions on how to use this sheet that I had created that I thought would kind of be like what site visitors would use to judge documentation. And then I just let them loose, and they would grab their whole domain stack, because remember, all hard copies of documentation, and they would just go through and mark through the forms, look at the documentation. Occasionally they would consult with each other, but mostly if they had a question, they would just raise their hand and I would answer the question. And that was really key. I wish that I would have done a better job of capturing the questions that they asked, even if because sometimes they wouldn't write them down. They'd just be like, oh, you know, there's not a date on this. Did this take place in the last 5 years? So having the accreditation coordinator in the room just to answer questions and meet whatever needs they have is very important, because if you're busy doing documentation review, then you're not going to be able to answer all their questions and give them the attention that they need. And then we debriefed at the end of day 1. And I simply said, what are the things that are going really well in terms of documentation? What are our strengths right now? What do you feel are areas of improvement? And I captured all of that. And it was very positive, and I wish that I would have done a better job of capturing all of that feedback so I could share it with all of our staff, because again, it was very positive. You all had done great work on your challenge-ship, and when good things come from accreditation and throughout the process, you need to celebrate those, because can be in a very exhausting and challenging process, and so when good things happen and people are excited about the work that you've done, you need to broadcast that to all of your staff. Day 2, they finished their documentation review. We had a discussion. Again, what things did you see that were great? What things did you see that weren't so great? And then we did that overall debriefing, and I had an evaluation that they filled out, and I'll show you that. And then we just kind of closed out. And my director was there for both days, and she, went above and beyond, thanking everybody for participating. But we got so much gratitude for including other people in not only in our accreditation process, but providing that opportunity to others to learn about our accreditation process that could benefit theirs. And like I said, there's just not that many opportunities like that right now, since accreditation and the process is so new. So this was the site visit forms that everybody filled out. I still have all of these, because as we submitted documentation, I wanted to match up with what the site visitors said and what our, preliminary site visitors had said. So they wrote down by number 1 what the title of the document was, so it could have been, the HR policy. And then I had them judge whether it was not demonstrated, slightly demonstrated, largely, or fully. Looking back, I would have done a little bit more training with exactly how they should score, because up until this point there had not been any scoring from FAB or their site visitors, so we were kind of doing a shot in the dark, but now we know more about what constitutes a not demonstrated and what constitutes a fully demonstrated. In the comment section, I asked them to explain what was missing or why it didn't meet the measure, and they had to leave a comment if they didn't judge it fully demonstrated. So if they didn't think that it was absolutely ready to go to FAB, then I wanted to know why, and they had to write it down. And then I also had a box on how to improve this piece of documentation. And again, if they didn't judge it fully demonstrated, they had to write down what was missing or what would have made this piece of documentation stand out and be great. And at the very bottom, I had them fill in this piece of documentation is ready to be submitted to FAB, or this piece of documentation will be ready to be submitted with the following changes, and this piece of documentation should be submitted or should not be submitted, and a new example should be given. Because there were some misses. There were some things that we had interpreted way different, and once we got in a room full of new people or external people. So at the end of the 2 days, we had 3 piles of documents. One that were ready to be submitted to FAB, one that needed a little bit of tweaking, and that could have been minor. It could have been, add these meeting minutes, or highlight this, or make the narrative more clear. Little changes, but it would take a little bit of time. And then the third category was just completely scratched, start over, you missed the mark. And we didn't have many of those, probably 5 to 10, so that's not bad. But, we just kept telling ourselves, we'd rather know this now before we submit than after we've already submitted to FAB and, our chances up. So we kept telling ourselves that, and it worked really well, and we had a lot of encouragement and a lot of encouraging feedback. Even if things were marked as fully demonstrated, some of our reviewers would say, this is an excellent document. And that's encouraging, especially to our team members that had worked really hard. So these are just some examples of what they looked like. So this one, like it says, it's fully demonstrated, but the narrative needed a little tweaking. It should have said MOA. So little things. Some people were really nitpicky. You'll see that in site visitors probably. Some people are really nitpicky. Some people, can look over some stuff. And I'll also tell you that our external reviewers were much easier. Like our Three Rivers people were much easier on our documentation than our external people. And that's why it's so important. If I do this process again, I will include probably more external people, because they were the ones that said, this acronym doesn't make sense, or you have these 2 meeting minutes, how do they connect? And our internal people were just kind of like, yeah, good job, thumbs up. So this one was largely, I'll have to, and he's just suggesting highlight page 8. You gave one example from Gallatin County, you should include one example from Owen County. So these are the types of things that we wanted to know prior to submitting. No signature and date, that's a big one. And then include minutes and strengthen your narrative. So again, the narratives, which according to FAB are called the document description, there's another spot that's called a narrative. Those are so important because that's what your site visitor sees the first time they hover over that title, and it's really important that they are understanding how what you provided conforms to what they're asking for. So at the end of day 1, they were saying some of the documentation is above and beyond what's called for. Lots of things that were fully demonstrated. The policies are exactly what they're asking for. Everything seemed organized. Strong relationship with our Board of Health, and that's very evident. Our vision statement is all one team, so that was also demonstrated. So that's some of the feedback. Some of our areas of improvement, number 1, narratives. Typos. The policy needs to be updated. Make the narratives more specific. Domain 7, weak. Shocker. That's like one of the biggest gaps for us. And then the health data profiles were weak. So we had some people that provided overall comments that were very general, like, you know, your narratives need to be strengthened. And then some people got very specific, your COOP plan needs to be updated. So this was our team of people. Like I said, it's a mix between our own staff and then staff that were outside of the agency. And this is the evaluation tool that I used. I asked them, how would you rate this experience? How did you like their review form? Because remember, all of this stuff is new. You know, there had been no accredited health departments at this point. What was the most helpful thing to you during this process? What would have been more helpful? Did this allow you to become more knowledgeable with the FAB standards and measures? I asked them, what is your definition of a highly functioning health department? Because I feel like that's something that's at the root of FAB is, are you a high functioning health department? What is the overall impression that your site visitors walk away with of your health department? So I kind of wanted a different of opinions on what makes a highly functioning health department. So that was kind of a selfish question, but I got some really good responses. And then regarding our documentation, what is your biggest concern? And then what do you think is our biggest strength? And I looked at all of them very, very intimately. But from our external reviewers, the ones that were from outside agencies, every single one of them rated it as a 10 for how they would rate the experience. And like I said, this was a shot in the dark from a freak out aha moment. This was not something that I had planned a lot. So that was extremely encouraging. And then our internal staff reviewers rated it as an average of 9. So again, the most helpful thing that they said over and over again was the fact that I was in the room and I was able to answer questions if they had them. So when you're going through the process, make sure that your accreditation coordinator is on site and is not bogged down with 20 other things so that they can give attention to the reviewers. What would have been more helpful? They said if I would have given them, especially to the people that were on staff for Three Rivers that were involved in the process, more of an overview of the standards and measures, because this was some of their first couple times seeing some of the measures that they were being asked to review. So ahead of time, especially with internal people that were going to be involved in the process, I would do a little training session with them on how to read the standards and measures, what keywords that they're throwing around that would be repeated throughout the process. And then everybody said that this experience allowed them to be more knowledgeable with the standards and measures. So for that, that was a success for me. Some of their other feedback said that they had a much clearer understanding of the process. They enjoyed seeing what really goes into each domain, because like I said, sometimes it's a pie in the sky. Access to care, workforce development plan. Until you see those things right in front of you, does it become really real and something that your health department does. Some lessons learned, again, me being there, available for questions, domain refreshers for those that weren't really involved with the process, or were subject matter experts that hadn't reviewed other domains. Copies of the standards and measures, so I had a copy for every single person. I have been to several health departments as they do these reviews, and they have the domains on a jump drive. So you just, put your hand in a hat and get a domain, and they're all on jump drives. And I really liked that because everything is already scanned. So if there's a scanning issue, you see it then, not when it's uploaded into EFAB. It's also just much easier to keep up with 12 jump drives and 400 pieces of documentation. The engagement from leadership, like I said, my director, Georgia, was involved with the entire process and during the documentation review, so I think that that's important to continually demonstrate the support that we had from our leader. They needed lots of workspace. Now, if you're doing it electronically, then everybody's going to have a computer and, possibly space for them to write out the forms. But for us, we filled up our entire conference room with tables, and, one reviewer could fill up a whole table because of all the documents that they needed to be spread out. So you got to have a lot of workspace, and then at some point include some sort of a visual walkthrough, so everything that you're saying is on your bulletin boards or posted on your front door. Make sure that it is, because your site visitors will be looking for that as well. So we moved from phase 2 to phase 3. So everything either was ready to be uploaded, needed a little bit of TLC, or we had to start over with. So at the end of our documentation review, I asked the external people, we gathered them in a room to thank them, and I said, do you think I can do this within 2 weeks? Because I really want to have this done by Valentine's Day. And then everyone said no. Give yourself more time. But I'm competitive, I'm from UK, so I'm like, no, we're gonna get a slam dunk. So we did. But it was a lot of work, and I was able to have a lot of support from all of my staff to get that done. And I just wanted to beat Keith, really.
Women number one.
So we had a lot of leadership support, and I know that is a continued theme today, but those 2 weeks between phase 2 and phase 3, my boss said, all right, you pull whatever staff you need to come and work on whatever needs to be worked on. But we're done with any waiting games, now it's go time. So whoever needed to be pulled into her office and said, all right, get this fixed, get this updated, get this signed, like everything was done within those 2 weeks. And so this is EFAB. I took a picture of this right before we sent it to FAB, but all the little boxes start out red. And then as you move through the process and upload everything, they turn to green. So when I had 96 green little dots, I couldn't believe it, and of course I had to take a picture. But the time period between our phase 2 and phase 3, most of my time was spent uploading. After it was uploaded, I would look at it, and then I would push the button for it to be, reviewed by Georgia, and then Georgia would take the time to look at it. So she was the final stop. So that was the end of the road was with her. And so I submitted all of it, and we had everything done by February 15th, one day after Valentine's Day. But I wanted to show you some other examples, because now that this was really successful for Three Rivers and Kentucky, we share everything with everyone. So we have a work group that comes together, and so other health departments realized how valuable this could be and made it even better. So this is an example from Knox County Health Department. This is how they organized it. It hasn't taken place yet, but they have been very detailed. You can see I didn't have anything like this put together ahead of time, but we know ahead of time that we will be assigned to domains. We'll have a partner to review all the documentation with. This is the Kentucky Department for Public Health agenda for theirs. We did theirs in one day, but theirs was all online, and they did theirs from a share site. So that's how we accessed all their documentation. And it was pretty straightforward. It went really fast. These are some tweaks to the review forms. So you can see that this also has a spot for documents to delete and documents to be added. And then this is Barren River's example, and it highlights the authenticity and date. So that was something that Lowry had brought up earlier, is everything has to be considered authentic. So that's one of the newer review forms that's been put out, because everybody has tweaks to it. You know, you have to make it work for your health department. And I really, really like that addition to the review form, because I think that that can be overlooked. This is Christian County Health Department in Kentucky, and the health department accreditation coordinator there wanted to make it more fun, and so we had a variety of smiley faces, and when we got done reviewing documents, then each one got a sticker that corresponded to that score sheet. So you got to make it fun when you can. So to wrap things up, after you submit all your documentation and before your site visit, I would recommend just a couple things. Prepare your staff. A lot of them can be uncomfortable with the thought of people coming in to look at your documentation. So tell them about their role. Explain to them that it's very non-threatening, and that FAB site visitors really are there to offer improvements, but really to check out your health department and the great things that it's been doing. Speak with your Board of Health. This was something else that was very successful to our board members. I got them together about a week before our site visit for like a 15-30 minute meeting one morning. I had breakfast there, went through a really short PowerPoint about what is accreditation, hit some key points about our process and how they were involved in our process, but they might not be thinking that they were involved that way. I also typed up a couple things that had been really successful in our health department over the past 5 years. We had received over $1 million in funding to build a new building. You know, those types of things they forget about. They have other jobs, you know, they're full-time employees somewhere else. But I wanted them to remember some of the great things that they had been involved in leading up to our site visit. And then engage your community partners, because they will be there during your site visit. It will be a huge love fest, because they'll all be bragging on the great work that you do in your community. But we did individual visits with our community partners that we were involving, and gave them copies of our challenge sheet again to remind them of their assessment and improvement process, and answer any questions that they have. And then again, we did one more last visual walkthrough to make sure that we had the appropriate signage up, and that everything we said was posted in our health departments was actually posted. So that was just leading up to our site visit. And this is our accreditation team after we received our status. We're doing a big all one team cheer. So what types of questions do you have? I know I covered a whole lot in a short period of time. But like I said, if I had known that it would have been beneficial to our health department, I would have taken more time to document and package everything that went on in that short period of time from January to February. Okay, Dana?
So how did you determine who was going to review what documentation? Did everyone review? Did you separate it, divide it? How did you do that?
The first day, I already had it pre-selected for them. And that was just based on the experience and the education that I knew they had. So day one, I knew I wanted Amanda, who was the PPHR recognized preparedness manager, to review our All Has plan and a lot of our environmental stuff, any type of AARs that we were submitting. And then on day two, they moved much quicker than I thought they would. And on day two, I asked them, okay, what do you all want to see? You know, there were accreditation coordinators in there that hadn't seen our strategic plan and they wanted to review that. So the first day, they were kind of voluntold what they were looking at, what they were going to look at and review. And then the second day, I said, you know, what would you want to see? You know, we're kind of an open book. I don't want you to walk away from here not seeing something that would have been beneficial to you during this process.
So you did like measure by measure as
Yep.
opposed to building?
Yep.
And then, so each documentation was only reviewed by one person?
2 people. Yeah. So every piece of documentation was in a laminated sleeve, and the first time it was reviewed, it got an orange dot, and then the second time it was reviewed, it got a green dot. So I knew at the end of that day 2, everything had been reviewed at least 2 times. You know, accreditation coordinators are very anal. So it was, you know, yeah, or organized, type A.
Thank you, we appreciate that.
Yes. It's our strength. That's why we excel in this job. Keith, did you have a question?
Yeah, actually, I want to compliment you on the mock site visit. I think that's a great plan. We didn't do that. I wish we had it. That's a really cool way of doing it. I'm kind of curious. It sounds like there's a lot of advantages to having people come to your site, sit there, you be in a room, answer questions and such. But in areas where maybe that's not possible to get them there or to get everybody there at the same time, you're wanting to get some specific expertise. What's your thoughts about doing maybe a virtual mock visit, similar to what the site visitors do during the pre-site visit phase?
Yeah.
If you had a SharePoint or something like that.
I think that I think it's possible. I think that as a volunteer or somebody that's doing it for another health department, you get overwhelmed with the thought, like, I don't have a set period of time to set this in my calendar to review. So a lot of times it could get pushed and procrastinated from somebody, whereas if you bring them together, you know that they're going to do it because you have a captive audience. If you do it virtually, then you run the risk of those, you know, volunteer site visitor type things not really doing it. And we had thought about doing it for another health department, and the volunteer type people were kind of like, you know, if I start looking at that in my office and then a phone call comes up, it's not going to get done, and I want to benefit this health department as much as possible. So I think you can do it. I just think you have to be pretty structured about it and have some built-in timelines so that you know the work's getting done. But it was extremely advantageous to have everybody in the room, and the discussion that was generated was very rich because people could say, oh, your community health assessment was great, but it lacked something. And then another person would say, oh yeah, I saw that too, here's some ways to build on it. You know, it was extremely beneficial experience for Three Rivers, but more so for the people that were involved.
Can we email you for access to some of the tools that you use?
Sure, and I, like you saw, I have examples from a lot of health departments. So a lot of other health departments have done this and make tools that, you know, meet their needs that might be more like your needs. But I think you'll see that as time goes on, these tools will become more user-friendly, and I know that NACCHO has a lot of examples as well. Any other questions? It was a lot of fun, and it honestly prepared me so much for the site visit because I got accustomed to the types of questions that were going to be asked, and it was really cool. It was fun.
I really like this domain-specific key messages. Was this created in anticipation for the site visitors
Yes.
and things?
Yes. So Alan at Northern Kentucky created that with his PIO, I believe, in preparation with their accreditation team to prepare for the site visit so that everybody can get on the same page.
And did this come from your mock site visit, or was this before?
It was, I think it was after. It was after, but Alan And Alan wasn't involved in, there's 3 accredited health departments in Kentucky, Northern Kentucky, Franklin County, and 3 Rivers. And I purposely did not invite Alan with Northern Kentucky or Judy from Franklin County because they were so involved in their own process that I thought it would be too overwhelming. But Alan did create that after probably 2 or 3 months prior to Northern Kentucky site visit. And that's another document that could be really easily modified to meet your own needs.
You spoke under your lessons learned about when you brought all of your reviewers together that you wished you would have maybe done something different with teaching them about the rating. What do you wish you would have maybe had some sort of criteria or?
Yeah, so that actually leads in.
What'd you do at the beginning to where you wish that you did something different?
In the beginning, I just kind of said, okay, so there's 4 ways you can judge it. And I listed them each, and I tried my best to explain how they could judge those documents. And fully demonstrated, I said, was just 110%, you would not change anything. Not demonstrated, you would be embarrassed if we sent that to FAB. And then, of course, the slightly demonstrated and the largely demonstrated, those are kind of gray because, you know, it's really at discretion of whether you think it's slightly or largely. So had I done it all over again, and what I'm seeing with other site visit or mock documentation reviews is more clear-cut criteria of if you think this would be 25 to 50% demonstrated, then judge it slightly. If you think it would be 50 to 75, judge it, or, you know, more specific criteria of how to judge the documentation. So for me, you know, that was our first go round, and I had no idea. And so we just kind of talked about it as a group prior to, but yeah.
That helps.
Yeah. Looking back when I was preparing for my presentation and I pulled all of those forms, I thought, wow, they are all across the board because some of them were fully demonstrated like you saw, but then they would have a way to improve it. I'm like, oh my gosh, you know, but score it as fully so that I don't overlook that. So yeah.
Did you see correlations between the feedback from your pre-site reviewers and the actual FAB site visitors?
Yes, especially in the 3 overall strengths and 3 overall opportunities for improvement. We definitely saw some of the things that our mock reviewers saw in terms of our leadership and our engagement in the community. They had said that was one of our strengths, and so we remembered that as we were typing up all the narratives and in our discussions with our site visitors, and then we saw that in our site visit report. So there was a lot of things that bled over into each other that our mock reviewers saw, that our real reviewers saw. And some of our mock reviewers said, you know, when they're here, make sure to brag about this because you all do this work every day, but because we work in another health department in Kentucky, we know that you all are way ahead of the pack in this. So make sure and brag about that because even though that's normal business to you all, that's not normal business to everybody else. So they also did a really good job of encouraging us to, you know, kind of brag about ourselves in some of the areas that we might not have thought about. But that key messaging document does a really good job of helping organize your thoughts prior to the site visit.
Just a quick comment, Dean, this may address, but I believe that Sandy and I both are kind of using this document, but I believe it's from Northern Kentucky District actually, that they actually developed their documentation tracking system.
Yes.
And within that, they have built in the slightly, largely, or moderately demonstrated, so it tracks your whole kind of piece. So you can do it internally for yourself, or you can have someone else do it, but it does track that piece, which I feel kind of useful. And then on the very first tab of it, it explains the mechanism for how they score those.
Yes, and if you want any of that stuff, Lowry and I both have Alan, and probably Dana, we all have Alan's contact information. He has a lot of great resources, just like some of the ones that I showed you were out of Northern Kentucky. Okay, well,
April, this is kind of out of left field, but I thought I'd ask it anyway. Do you see in retrospect where University of Kentucky College of Public Health could be incorporated into helping you or facilitating your effort, or did you use them at all?
we did not use them. We had invited them to our mock site visit, and unfortunately, Angie couldn't come. Cynthia Lambert, who is faculty at UK, actually came to our site visit and spoke to our community partners about the academic relationship that we had to our site visitors. So they played a part in our site visit, but we also wanted to use a little extra caution with UK and the College of Public Health there, because Dr. Scutchfield is the Accreditation Committee Chair at FAB, and so we just didn't want to, kind of cross any paths there. But we do work with UK a lot. We are a part of their research network in the local practice area, so we use some of that documentation with our PBRN relationship. But yeah, they're a great resource. And they're doing a lot of great TA work with community health assessments and community health improvement plans across the state. So we work a lot with them.
Could you be a little more specific about your selection when you say you picked frontline people?
Yeah. So let me tell you about who we picked. Diane Coleman is a nurse that has experience. She's a health educator. So in Three Rivers, the health educators, we have a health educator in each one of our 4 counties, and they are responsible for facilitating the MAP process. So they each formed a partnership in all of their counties, and they meet every month to work on MAP. And Diane leads the most successful of our partnerships across the district. So she's a nurse, but she is a health educator. And then Sarah, the girl next to me is Sarah, and she is an environmentalist. So she is the one that goes out and does all the inspections, you know that. Again, Diane had been there for about 10 years. Sarah had been there probably less than 2 years. But she is frontline, she has a supervisor and a manager that were not picked. And then we have Michelle, who is works in our administrative department with the budget and had her hand a little bit in HR. But she's since been promoted to a supervisor, but at the time she again had a manager above her. Cassie is actually an employee of our home health agency. We have a home health agency attached to our health department, and as you all know, you cannot submit any home health documentation. So she helped me stay sane throughout the process because she's also very organized, and it was a way for me to include our home health agency, which honestly has about half of our staff at Three Rivers. So it's a good way to keep them involved, and Cassie is a billing clerk. And then we had Alicia, who is a frontline clerk or clinic staff. She's a nurse. She does all the nurse. We have one nurse for each health center, and she was the primary nurse for our Owen County Health Center. And then we have Dr. Georgia Heiss, who's our director. So they were all just, none of them had supervisory experience. They did not have any supervisory duties. And with the exception of Diane, had all been in their job less than 2 or 3 years at Three Rivers. So I just saw that it would be a huge learning opportunity. And when Georgia approached me about being the accreditation coordinator, I told her no, because I was working in preparedness and I loved it, and I thought, nah, that looks kind of scary, change, I'm not going to go down that route. And then slept on it a couple nights and thought, this is a huge opportunity. And when I was looking at all of the staff across our agency, and I knew that I could have my hand in picking my team, I thought, okay, who works really well with me? That's important. And then who has really good relationships with the rest of their staff. And all of these ladies have really good working relationships with their managers and with their fellow frontline staff. And so when they were going to ask for documentation, instead of, oh, April's asking for another thing, or their manager is asking for another thing, how they show they do their job, I thought it would be better if it was Alicia, their fellow peer clerk or nurse, asking for an epi form or something like that. Okay, well, we are going to move into, in the spirit of moving right along, we're going to talk more about how to review documentation, and goes along right with the question of how do you score something not demonstrated, fully demonstrated, etc. So Lowry is passing out some examples. She's got one example per row. So you have an example piece of documentation, and then you'll also have the standard and measure that it goes with. So you will take a minute, speak with your row of people about how you would judge it and how you would score it. So I'll move to the slide that kind of has those listed so that you can see how the possibilities of scoring it. So fully demonstrated, there's nothing wrong with it. You don't see any opportunities for improvement with that documentation. You can read the standard and measure and then see that piece of documentation and you know exactly that it meets the measure. Largely demonstrated would kind of be like that 75 to 95% range. That it's not completely there, but the majority of it is there. Slightly demonstrated is there's a lot of gray area. You're not exactly sure. You think that they're headed down the right path, but all the components aren't there. And then not demonstrated is 0%. Like this is absolutely not what they're looking for. Or it could be that the date isn't on there, there's no branding, you have no clue where this came from. So again, Lowry's passing out the standard and measure and then an example piece of documentation, and you can talk amongst your row about how that would be scored. And then we'll have about 15 minutes that you can work on that.